New COVID cases in Louisville have doubled in the past week, and most of them are the Delta variant. That's according to Louisville Metro Health.
They say contact tracing shows people are going about their lives basically the same way they were before COVID-19, even though we are still in a pandemic. Dr. Sarah Moyer says Jefferson County is still in the yellow, meaning 1 in 10 people per 100,000 people are testing positive. She says at the rate that we're going, we'll probably be at the orange level by the end of the week. That level means 10 and 25 people are testing positive per 100,000. Metro Health says most cases are in younger people.
Incidence of cases is moving down in age. It's moving more hospitalizations in the younger children. So you can only think that when school's back in, we're going to have another surge. And that's my real concern.
Now, the Delta variant is continuing to spread throughout our community. It's infected both vaccinated as well as unvaccinated people.
And Rob is here to tell us how many of those breakthrough cases we're seeing. And Rob, what does this mean as more places continue to open and school gets ready to go back too?
An important question, Kristen, the doctors are going to be keeping an eye on. They're also going to be looking at these cases because the worry is that at some point the COVID virus will mutate even further into a strain that the vaccine doesn't protect against. So that's not the case right now, though. We are seeing a small number of breakthrough cases associated with all 3 vaccines that are available. Louisville metro area is reporting 100 cases or more, and the state of Indiana overall has seen 2,720 breakthrough cases so far. The Delta variant of the COVID virus appears to be playing a key role in these breakthrough cases. It's the most contagious version of the virus we've seen, leading to infections even when people are spaced out and not around each other for long periods of time. Even still, your odds are way better being vaccinated. Look at these numbers from the state of Indiana. Less than 0.1% of people who are fully vaccinated have tested positive for COVID at all, and 0.005% of fully vaccinated people have been hospitalized. 0.002% of fully vaccinated people have died from COVID.
You are going to see some breakthrough infections, even for vaccinated people. The good news is those people are not getting particularly sick. Obviously, very, very few people who are vaccinated end up hospitalized or dying. That's what's really useful here. But no vaccine is perfectly 100% effective.
The concern doctors have going forward is that more variants like the Delta variant, or maybe even worse, will come along and they'll result in higher levels of breakthrough cases, or maybe even a mutation that can evade the vaccine altogether. The best way we can avoid that is by getting to herd immunity faster than the virus can spread. Kristen?